and welcome to our presentation on teenage pregnancy and risky sexual behavior. Today I'm going to be talking about the scope of the problem. So we're going to take a little bit of a historical perspective and compare it to statistics today to sort of gauge where we are. Then what we're going to do is we're going to take a look at some of the antecedent characteristics, or some of the things that cause risky sexual behavior in teenage pregnancy. Let's get started. All right, so we're going to talk about the scope of the problem, precursors of teen pregnancy, and I'm just going to let you know what we're going to be discussing during this presentation. So we're going to talk about the incidence and frequency of teenage sexual behavior, how often it happens, the consequences of early childbearing in teen pregnancy. We're going to be talking about AIDS and other STDs, and we're going to be talking about intervention strategies and then specific interventions. So let's get started. Sort of counterintuitive to what you might think, teen birth rates are actually the lowest ever recorded level, and they've been decreasing steadily since the mid-1990s. This is thought to be due to decreased sexual activity and also increased use of contraceptives. 6 out of 10 teens are sexually active at the end of high school, according to one set of statistics. And I pulled some information from the Stats Canada. 20% in the US and 12 to 13% Canada of 15-year-olds are sexually active. So it's a little bit lower in Canada, but it's in the same ballpark. The U.S. actually has the highest teen birth rate of comparable nations. So that's actually that's over 50 developing nations, so it's a pretty considerable statistic. It's thought to be due to lack of accessible contraceptives, either being non-confidential, not widely available, especially to teens or people with low economic status, and because they're not free and they're expensive. Some nations offer them for free. So at age 15, about 2 out of 10 girls and 3 out of 10 boys are sexually experienced, but at graduation, it's actually 2/3 of all teens are sexually active. And of the experienced group, you'll actually find that 25% were experimenting with drugs or alcohol at their first sexual experience. And the younger girl is, when she has her first sexual experience, more likely she was either coerced into sex or had unwanted sexual contacts. That's something to be aware of. So we're going to talk about the common background characteristics. And we're going to talk about adolescent development first, and it's the longest. And then after that, we'll also touch on antecedent characteristics, interpersonal influences, and media influences. So the first one we're going to talk about in adolescent develop is the negotiation of adulthood. So more than 80% of teen parents never expected to conceive a child. This means that they either didn't think about the consequences of risky sex, or they didn't have adequate knowledge of contraceptives and pregnancy. So it might be just a lack of information. Teens sometimes use sex to develop an adult identity and challenge parents. And this is because sex is seen as a very inherently grown-up act, and it's a way to take on that adult role. Some teens use it to seek validation and approval from sexual peers. If a teen doesn't feel valued or beautiful at home, they can certainly feel desirable from a sexual peer. So that's one of the ways that ends up happening. Sex is also used as a formation of sexual identity. So many teens who experiment with the same-sex partners don't actually identify as gay or lesbian. And the process of developing a lesbian, gay, bi, transsexual, queer, two-spirit, or questioning identity is non-linear. There's progressive but also regressive steps, and it's not a set way or one specific way to develop an identity if you belong to the LGBTQ community. These teens tend to fear stigmatization. This is due to a lot of bullying that this demographic encounters, so it's a fair fear, and this creates anxiety. Anxiety, of course, positively correlates with drug use, running away, family rejection, and risky sex. So as CYC practitioners, it's a really important community to be aware of, definitely, and the role that risky sexual behavior plays in this. The last one we're going to look at for adolescent development is testing future roles. So developmental steps are accelerated by an unwanted teen pregnancy. All of a sudden, the daughter becomes the mother, and they're in that sort of caring role. It's no longer being taking care of themselves, but taking care of someone else, and they have to immediately cope with having adult roles, and it's very difficult to do as a teenager without support. So that's part of it. We're going to talk about the antecedent characteristics now, and then we'll just have interpersonal influences and media influences after that, but they're a bit shorter. So in terms of protective factors, you can actually, higher self-esteem protects youth. It makes them less likely that they're going to have risky sex or be pregnant. So it's good to instill that in your youth. Delinquent activity and drug use often precede teen pregnancy, which is a risk for the child they're carrying. Pregnancy might represent gratification and independence because the word, parent defines a clear adult role. Teens who engage in risky sexual behaviors are likely to reject societal norms, have limited knowledge of their bodies, difficulty using information about birth control. They tend to be biologically mature, but less religious. They're also likely to have low socioeconomic status and low educational expectations, so they might not expect to be able to get very far. Family strife and instability. So again, a sense of hopelessness or sort of instability, chaos tends to contribute. The next one we're going to talk about is interpersonal consequences. So relationships with parents is very important, especially the mother-daughter relationship. The mother will be the biggest influence on her daughter, whether or not to have an abortion or to keep the child. And she also has the ability to be the biggest support for her daughter as her daughter has a child. And it's a really important relationship. Peer dependence is also big. Teens tend to rely on their peers for information on sexual activity and contraceptives. This can be risky, however, because their peers may not be providing reliable information for teens. So when they rely on this information, it can have poor results. The last one we're going to talk about is media influences. First of all, sexual messages are prevalent in the media. And they give the impression that all other teens are having frequent and casual sex. And this is a message that is sent out on billboards and television shows and magazines. Frequency of watching television actually directly correlates with teens' belief about sexuality and how likely they should be having it. And you can imagine if you're watching several hours a day or a week, some people do watch several hours a day, it's going to influence a teen's perspective of the world. Unfortunately, on most television shows, our most channels and broadcasting stations are very reluctant to depict contraceptives. Although they will depict heavy sexual themes, they're very reluctant to advertise condoms or birth control or morning after pill or advertise about safe sex. There's very few things to hear about safe sex on television that's being given to these youth. There's a lack of helpful messages in mainstream media. And there's a dissuaded view of what is sexual risk. That concludes my part of the presentation. I hope you enjoyed it, and I hope you enjoy the rest of our presentation and have a wonderful day. Thank you very much.